this is Catherine. Welcome to Double O Kidney. In today's video, I'll show you how to reduce creatinine level naturally in chronic kidney disease and how to prevent kidney failure. There are some kidney failure treatments without dialysis that can help you in surviving kidney disease. And I want to clarify one thing immediately. You can beat this terrifying disease. You will need just two things: the right knowledge and the right attitude. It requires a lot of willpower and strength to overcome kidney disease. But if you're here and you have decided to fight, then you can do it. Okay, today I'm talking about a very big and important topic because it's always the first thing that people ask me. How do I lower creatinine levels? How do I increase GFR? How can I take care of my kidneys? These are the questions that I want to answer today. So I'm going to talk about the topic of lowering creatinine and the topic of curing kidney disease naturally a bit more in depth than usual. Let's start with the answer to one of the most important questions. Is it possible to improve the GFR and kidney function in kidney patients? Yes, there are ways to improve your kidney function in all the stages. There are ways to improve your creatinine levels. It requires some changes in your renal diet and some changes in your lifestyle. It's not easy for everyone, but I've seen people do it. Taking care of your kidney health the best way may be hard work, but it pays. Let me ask you a question before we move on. When your doctor told you you have kidney disease, did he explain to you how to manage it? Has he told you that there are dietary and lifestyle changes you can do to greatly improve your health and to actually survive CKD and to avoid dialysis? I'm just asking this because a lot of doctors just forget to tell their patients what to do. If you're one of these patients, this video is for you. And if you know anyone suffering from CKD who can benefit from this guide, send them this video. You can help them too. Today, I'll show you the first steps towards the goal of surviving kidney disease and avoiding dialysis. Okay. The kidneys are two organs situated in the back of the chest in the lower part of the rib cage. They are about the size of a fist and weight about 5 ounces each. So if you do a fist like this, well, this is about the size of your kidneys. Each kidney has millions of nephrons. They are the filtering units of the renal system. The kidneys are part of the urinary tract. They filter the blood from wastes and excess water. They filter about a half cup of blood every single minute. They remove toxins and unnecessary fluids and combine them to make urine. The urine goes from the kidneys to the bladder through these two thin tubes. These are called ureters. The kidneys, the bladder, and the ureters are part of the urinary tract. Now, let's say that your kidney function is compromised. What happens in this case? Well, if the loss of kidney function is gradual and happens over the course of the years, we're talking about chronic kidney disease or CKD. Most of the people that are watching my videos suffer from CKD, so this is what I'm focusing on today. CKD has 5 stages, as you can see in this chart. Chronic kidney disease is divided in 5 stages, from mild damage in stage 1 to kidney failure in stage 5. These stages are based on how well the kidneys can filter the blood. Creatinine levels are just this, an indicator of how much the kidneys are operating. We don't talk about creatinine levels usually, but about their corresponding GFR. When the creatinine goes up, GFR goes down. So you want to have a high GFR and a low creatinine. GFR means glomerular filtration rate. It tells us how much blood the kidneys can filter each minute. It can also be seen as a percentage of kidney function. If your GFR is 100, then your kidneys are likely working at 100%. If it's 50, they're at 50%, and so on. As you can see from this table, your kidneys are still able to filter out waste from the blood if you are in the early stages of kidney disease. Then kidney function slowly declines until the kidneys no longer work in the final stage. Now, in this table, I also included the symptoms. They are very important to diagnose CKD. People do not often get diagnosed in the stage 1 and 2, so they don't even know they have kidney disease. This is because stages 1 and 2 have no visible symptoms at all. In some cases, there is proteinuria already in stage 2, but that's a symptom that only shows up in blood analysis. If you don't know if you have CKD and you're worried, do not rely on symptoms. Ask your doctor for a screening, a simple blood and urine test that will tell you in which stage you are and if you have CKD at all. However, if you get diagnosed in stage 1 or 2, lowering your creatinine is going to be easier. CKD in stage 1 and 2 is a lot easier to manage and to reverse because there are a lot less dietary restrictions, and obviously the kidneys are still in a relatively good shape. There is a lot more you can do. There will not be fluid restriction and the renal diet will be a lot easier. Unfortunately, people do not often get diagnosed at these stages because there are no symptoms. To know if you have kidney disease when at stage 1 or 2, you have to get checked for creatinine levels and for proteinuria, proteins in the urine. So people don't usually get diagnosed until stage 3, when the first symptoms show up. When the kidneys are still operating at more than 60% of their function, they are still able to perform their job well enough to make everything look fine. But it is not. There are already damage that are being done. And most importantly, there's something like, for example, diabetes or high blood pressure that is going to make things a lot worse over the years. So when people get diagnosed at stage 2, it's usually because they were getting tested for something else, diabetes or high blood pressure usually. So if you get diagnosed at stage 1 or 2, don't just wait for symptoms to show up. Start immediately to take care of your kidneys and start a treatment to lower creatinine levels. Creatinine is an indicator of kidney function. So if I say lower creatinine, what I mean is to improve kidney function. Now, what can we do at stage 1 or 2 to reduce creatinine level naturally? Remember that these stages your GFR are still above 60, meaning that your kidneys are still working at 60% or more. Okay, don't skip this part if you're in stage 3, 4 or 5, because most of these things are going to be valid for everyone. Number 1. Get checked regularly. Regular checkups with your doctor to monitor creatinine, GFR. Get checked regularly. Schedule regular checkups with your doctor to monitor creatinine and GFR. This is important because at these stages CKD are still very manageable, and to prevent kidney failure and avoid dialysis, we just need to avoid further damage to the kidneys. Number 2, renal diet. Limit sodium, protein and cholesterol intake. Eat plenty of fruit and vegetables. Avoid junk foods and sodas. The diet is really important. Already in these stages, we need to limit sodium, protein and cholesterol intake. So no junk foods or processed foods. Eating plenty of fruit and vegetables will help us getting the nutrients and the vitamins our body needs. In stage 2, usually potassium is not restricted, so don't worry about it unless your doctor told you otherwise. Number 3, lower blood pressure. Take the necessary steps to keep a healthy blood pressure. A lot of people get CKD from high blood pressure. So if you have hypertension, that could be what's causing your kidney problems. Take the necessary steps to keep a healthy blood pressure. This means that your blood pressure should be 125 on 75 or lower. This is true not just for stages 1 and 2, but for basically everyone. Most of these steps I'm describing in this video, the renal diet, the treatments, will help reaching the goal of lowering blood pressure to an healthy level. This is because hypertension is the second main cause of kidney disease. So if you have hypertension, it is going to damage your kidneys. If you want to cure kidney disease naturally, the first thing you want to do is to lower blood pressure. Number 4, keep blood sugar or diabetes under control. Now, diabetes is the number 1 cause of kidney disease. So, like I've said for blood pressure, everyone needs to keep blood sugar under control to improve their kidney health. The kidney-friendly diet, the medications, the lifestyle changes, everything we will do is basically aimed at keeping blood pressure and blood sugar levels at healthy levels. This will give our kidneys the chance to recover. Number 5, lifestyle changes. Stop smoking, drink only in moderation, avoid irregular sleep patterns, exercise regularly. This can help basically everyone, no matter the stages. Stop smoking, drink only in moderation, avoid irregular sleep patterns, exercise regularly. There is a lot to do here, but these changes are really important. And for the last Number 6, avoid painkillers. Regular use of NSAIDs like naproxen, ibuprofen has been proven to cause life-lasting kidney damage, so avoid them. Now, let's talk about the third stage of chronic kidney disease. Now, looking at this table, it is clear that when we get to CKD stage 3, things are already starting to get a lot worse. GFR is between 30 and 59 milliliters per minute. In stage 1 and 2, other organs in the body aren't yet affected, but in stage 3 things will be different. Changes in blood and in the urine will be a lot more visible. I've written in this table that all the symptoms start to become visible in stage 3B with a GFR below 44, but reality is a little bit more complex, and there could be cases when the symptoms start to show up at a different time. As you can see, stage 3 is divided in two parts, stage 3A and stage 3B. Stage 3B is when usually the symptoms are becoming more visible. Now let's talk about these symptoms for a moment. We can see in this slide the very first symptoms that are clearly noticeable are back pain, foam in the urine, swelling in the hands and feet, urinating more or less than normal. Actually, the foam in the urine is the very first thing people could notice in a lot of cases. Sometimes, even before stage 3, the foam is caused by proteinuria, a leakage of protein in the urine. Proteinuria is very common in stage 3, but can be also present in stage 2. Now, if we are in stage 3, all the symptoms are still manageable. With the right treatment, there are great chances of improving our renal function. Obviously, the sooner we diagnose kidney disease, the better. But as I was saying, it's a lot more common to get diagnosed in stage 3 when all these symptoms are becoming visible. Let's talk about the correct treatment for stage 3. If you want to improve kidney function in stage 3, all the considerations I've made about stage 1 and 2 are still good. So keep getting checked regularly for kidney function, blood pressure and blood sugar levels. Blood pressure and blood sugar levels are even more important right now. The correct lifestyle and dietary choices will help us in reaching the goal of managing them. So try to improve your lifestyle, avoiding the bad habits that are causing problems to the kidneys. There will be some differences in the renal diet when we are in stage 3. Like in stage 2, it's still a good idea to limit sodium, dietary cholesterol and protein intake. Limit, not avoid totally. You will still need some of these nutrients in all the stages. What you don't need are junk foods and sugary foods. Potassium may be restricted in stage 3, but it's a decision that only your doctor can take because it depends on the results of the blood test. Okay, here we are. Vitamin supplements, C and B complex. Vitamin C and vitamin B complex are usually prescribed to patients in stage 3. Okay, let's get back to our symptoms table. As you can see, in the later stages, there will be other symptoms we haven't seen before. When kidney function drops below 30, stage 4, things are already pretty bad. But patients in stage 4 usually still don't need dialysis. At stage 4, it's necessary to see a nephrologist, a kidney disease specialist, at least every 3 months. Regular blood tests are going to be scheduled to check for hemoglobin, creatinine, calcium and phosphorus levels. These tests will tell us how much the kidneys are working. Again, high blood pressure and diabetes will be monitored. In stage 5, these tests should be even more frequent. Now, all these symptoms are going to be reduced in case of dialysis. Dialysis is usually started in stage 5 of CKD. In stage 5, the kidneys are no longer able to remove toxins and extra water from the body. These build-ups will cause an overall ill feeling. The kidneys also regulate blood pressure and produce hormones important for our red blood cells and bones. They will no longer do this in stage 5. So patients at this stage will need to see a nephrologist regularly and to be constantly monitored. Symptoms of the advanced stages of CKD include itching, muscle cramps, nausea and vomiting, not feeling hungry, swelling in the hands and feet, back pain, urinating more or less than normal, trouble breathing, and trouble sleeping. These symptoms are mostly caused by a condition called uremia. Some people call uremia urine in the blood because the toxins that the kidneys should remove through the urine, creatinine and urea, are still in the blood. So, one of the most important objectives of the treatment of the advanced stages of CKD is to reduce uremia. This is also what dialysis is doing. It filters the blood and removes all the toxins the kidneys cannot remove anymore. Okay, now that we have clarified the symptoms, let's talk about the treatments. Like for the other stages, avoiding bad habits and getting checked regularly can really help. There will be significant changes in the renal diet now that the kidneys have lost almost all their filtering ability. We will still need to limit sodium, protein and cholesterol intake. Obviously, avoid completely junk foods and packaged foods. Potassium is usually restricted in stage 4 and in stage 5. This is a serious limitation because a lot of the fruits and vegetables that were perfectly healthy are now dangerous. Bananas, oranges, cantaloupe, honeydew, apricots, spinach, potatoes, beans, just to name a few, are now to be avoided. Patients usually have a 2000 milligrams per day allowance of potassium and shouldn't eat more than that. In stage 5, fluid intake is going to be restricted too. So this is another thing to consider in the choice of the diet. Patients will have to choose meals that are not making them thirsty. Now, the diet of a renal patient is a really wide topic that I'm really trying to tackle thoroughly here on Double O Kidney. I'm uploading new recipes weekly, and I've made a series of videos on how to set up a kidney-friendly diet. Diet is always a very predominant part of the everyday life of a kidney patient. So I'm trying to make things easier for patients, creating recipes healthy and tasty. Also, there are supplements. As we have seen, the kidneys will no longer be able to produce hormones needed by our red blood cells and bones, and to regulate blood pressure. So in stage 5, you will also be prescribed a specialist type of vitamin D that can help solving these issues. Iron will be prescribed too, alongside vitamin B and C. Okay, the situation seems pretty dire right now. But there is a very important thing that I want to tell you. This is it. You should never lose hope, and it's normal to be scared, but you can still win this battle. I've seen people doing it, surviving kidney disease. Some of them even reversed it. There are new treatments being developed as we speak, and dialysis and transplant may not be the only option in just a matter of years. So don't lose hope. Where to go from here? I've made a playlist with a lot of detailed information on the right. Renal-friendly diet that you can watch right now to have more detailed information on the topic of the diet. I've made a playlist. You can find it up here. This is all for today. Thank you for watching.